For years, I told every patient the same thing. Cut the salt, watch your sodium, read the labels, and most of them did. They bought the low sodium bread, they stopped adding salt at the table, they did everything right, and their blood pressure barely moved. I used to think they just weren't trying hard enough. I was wrong. What the research now shows, and what most doctors still aren't telling their patients, is that what's missing from your plate matters more than what you remove from it. The deficiencies you don't know about are doing more damage than the salt you've been avoiding for years. In this video, I'm going to walk you through 5 food-based strategies backed by some of the largest clinical trials ever conducted that can lower blood pressure by 5 to 14 millimeters of mercury without a single new prescription. And the last one will surprise you because it's not a food at all. It's a daily habit that may be silently undoing everything else on this list. I'm a doctor who spent years working with older adults on blood pressure management, and what I'm about to share changed the way I counsel every senior patient who walks into my office. Before we get into the strategies, I want you to meet someone. Margaret is 72. She's a retired school teacher in Ohio. She's been on a low sodium diet for 4 years. She cooks every meal at home, she takes amlodipine, she walks 30 minutes a day, she even keeps a food journal. And her blood pressure is still sitting at 148/92. Her doctor just added a second medication. Margaret is frustrated. She's doing everything she's supposed to do, and the numbers won't come down. By the end of this video, you'll understand exactly why and what she was missing. Let's start with the first strategy. Most people think managing blood pressure through diet means eating less sodium. And yes, sodium matters, but there's another mineral that the research says matters just as much, maybe more, and almost nobody is getting enough of it: potassium. Here's how it works. Potassium activates a pump on the surface of your blood vessel cells called the sodium-potassium ATPase. That pump pushes sodium out of the cell. When sodium leaves, calcium follows. When calcium drops inside the smooth muscle cell, the muscle relaxes, the vessel opens up, blood flows more easily, pressure drops. But potassium doesn't stop there. It also suppresses the release of renin from your kidneys, one of the hormones that drives blood pressure up. And it dials down the sympathetic nervous system, the fight-or-flight wiring that keeps your vessels constricted. Basically, potassium is doing 3 jobs at once, and most seniors are barely getting half the amount they need. Now here's where it gets practical. You don't need a potassium supplement, you need a different salt. In 2021, the New England Journal of Medicine published one of the largest dietary trials in the history of blood pressure research. It was called the Salt Substitute and Stroke Study. Almost 21,000 participants across 600 villages in rural China. All of them were over 60 or had a history of stroke or had uncontrolled hypertension. The intervention was absurdly simple. Replace your regular salt, 100% sodium chloride, with a salt that's 75% sodium chloride and 25% potassium chloride. That's it. Same shaker, same cooking, same taste, just a different salt. Over an average of nearly 5 years of follow-up, the group using the potassium-enriched salt had a 14% lower risk of stroke, a 12% reduction in cardiovascular death, and a significant drop in blood pressure, all from switching one ingredient. And what surprised me, when I first saw that a simple salt swap in 600 villages could prevent strokes at that scale, I had to read the paper twice. 2 years later, in 2023, Nature Medicine published a follow-up trial in 48 elderly care facilities in China. Same concept, salt substitute versus regular salt. The results were even more striking. Systolic blood pressure dropped by 7.1 millimeters of mercury, and cardiovascular events dropped by 40%. And it's not just your arteries. This same sodium-potassium imbalance affects your kidneys, your bone density, and even your cognitive function as you age. So what do? Walk into any grocery store and look for a potassium-enriched salt substitute. It's usually right next to the regular salt. The label will say something like light salt or half salt, or list potassium chloride as an ingredient. Use it the same way you use regular salt. One swap, that's it. One important note, if you have advanced kidney disease or you're on a potassium-sparing diuretic, talk to your doctor first. For everyone else, this is one of the most evidence-backed dietary changes you can make. Now let's move to the second strategy, and this one involves a biological pathway that most people have never heard of. Your body makes a molecule called nitric oxide. It's one of the most powerful vasodilators in your system, meaning it relaxes your blood vessels and lowers pressure. When you're young, your blood vessels produce plenty of it through an enzyme called endothelial nitric oxide synthase, or eNOS. But here's the problem. As you age, that enzyme becomes less efficient. By the time you're in your 60s and 70s, your endothelial production of nitric oxide has declined significantly. And this is one of the main reasons blood pressure creeps up with age, even in people who are otherwise healthy. But your body has a backup system, and it starts in your mouth. When you eat nitrate-rich vegetables, spinach, arugula, beet greens, lettuce, bok choy, the nitrate enters your bloodstream and gets concentrated in your saliva. Bacteria living on the back of your tongue convert that nitrate into nitrite. You swallow the nitrite. Your stomach acid converts it into nitric oxide. The nitric oxide enters your bloodstream. Your blood vessels relax. Your blood pressure drops. Basically, the bacteria on your tongue are running a pharmaceutical factory, converting salad into a blood pressure medication. And this pathway becomes more important the older you get because it's compensating for the decline in your endothelial system. A landmark trial published in Hypertension, the Journal of the American Heart Association, tested this directly. 68 patients with hypertension were randomized to drink either 250 milliliters of beetroot juice or a placebo, which was beetroot juice with the nitrate removed, every day for 4 weeks. The result? A 7.7 over 2.4 millimeter drop in blood pressure. And it wasn't just the numbers on the cuff. Arterial stiffness improved. Endothelial function improved. These are markers that predict whether you're going to have a heart attack or stroke years from now. What I found striking is that we've known about this pathway for over a decade, and yet most doctors still don't mention leafy greens as a blood pressure intervention. They'll prescribe a calcium channel blocker in a heartbeat, but they won't write 2 cups of arugula on a prescription pad. An umbrella meta-analysis published in 2024, pooling data from 113 studies and over 2,000 participants, confirmed that dietary nitrate consistently reduces blood pressure, and the effect gets stronger the longer you take it. And here's a detail that matters. A 13-week pilot study in overweight and obese adults aged 60 to 75 found that a moderate dose of dietary nitrate improved blood pressure and endothelial function, but a high dose did not. More is not better. A cup or 2 of leafy greens a day, or a small glass of beet juice, is the sweet spot. The practical advice is simple. Eat more arugula, spinach, beet greens, and lettuce. Raw is better. Cooking breaks down nitrate. A big salad at lunch, some raw spinach in a smoothie, a small glass of beet juice. These aren't exotic superfoods. They're the cheapest vegetables in the produce section. And it's not just your blood pressure. This same nitric oxide pathway affects your brain circulation, your exercise tolerance, and even how well your immune system responds to infection. Now, strategy number 3, and this one is personal because I almost missed it myself: magnesium. More than 25% of adults in the United States have what researchers call chronic latent magnesium depletion. That means their cells are running low on magnesium, but it doesn't show up on a standard blood test. Why? Because less than 1% of your body's magnesium is in your blood. The rest is inside your cells and your bones. So your doctor can run a basic metabolic panel, see a normal serum magnesium level, and tell you everything looks fine, while your cells are starving. This matters enormously for blood pressure. Here's the cascade. Magnesium blocks a specific type of calcium channel on nerve endings, the N-type calcium channel. When those channels are blocked, less calcium floods into the nerve ending. Less calcium means less norepinephrine gets released. Less norepinephrine means your sympathetic nervous system quiets down. Your vessels relax, your heart rate eases, your pressure drops. At the same time, magnesium directly relaxes the smooth muscle in your artery walls through a separate set of potassium channels. It's working on 2 fronts simultaneously. Basically, magnesium is your body's natural calcium channel blocker and your natural beta blocker rolled into one mineral. A meta-analysis published in Hypertension in 2025, 38 randomized controlled trials over 2,700 participants found that magnesium supplementation reduced systolic blood pressure by about 2.8 millimeters of mercury on average. That sounds modest, but in the subgroup of people who were both hypertensive and had documented low magnesium, the drop was 7.7 millimeters of mercury systolic. That's comparable to adding a medication. A separate umbrella meta-analysis from 2024, pooling 10 review papers covering over 8,600 participants, found that doses of 400 milligrams per day or more reduced systolic pressure by 6.4 millimeters and diastolic by 3.7. Now here's where it gets troubling for seniors specifically. Older adults are hit with a double blow. First, many are taking proton pump inhibitors, medications like omeprazole, lansoprazole, pantoprazole for acid reflux. These are among the most commonly prescribed drugs in people over 65, and many take them for years. PPIs block a channel in the intestinal lining called TRPM6, the main active transport channel for magnesium. With TRPM6 impaired, your gut simply can't absorb magnesium efficiently. The FDA issued a safety warning about this back in 2011, but most patients still aren't being monitored. Second, many seniors are on diuretics for blood pressure, and diuretics flush magnesium out through the kidneys. So you have a situation where the medications prescribed to manage blood pressure are depleting the very mineral that helps control blood pressure, and almost nobody connects those dots. Remember Margaret? She's been on omeprazole for 6 years. And no one ever checked her magnesium, not once. And what surprised me is that magnesium deficiency also blocks your body from correcting low potassium. There's a well-documented phenomenon where you cannot fix hypokalemia until you fix hypomagnesemia first. So even if you eat bananas and avocados all day, without enough magnesium, the potassium can't do its job. What should you do? Start with food. 1 ounce of pumpkin seeds gives you about 156 milligrams of magnesium. A cup of cooked spinach, 157 milligrams. An ounce of dark chocolate, 65 milligrams. An ounce of almonds, 77 milligrams. If you're on a PPI or a diuretic, talk to your doctor about supplementation. Magnesium glycinate or magnesium citrate are the best absorbed forms, and 400 milligrams a day is a reasonable target based on the evidence. And it's not just your blood vessels. Magnesium deficiency accelerates arterial stiffening, the single biggest driver of isolated systolic hypertension in seniors. It's also linked to insulin resistance, inflammation, and bone loss. Fixing one deficiency can ripple across your entire cardiovascular risk profile. Now, strategy 4, and this one genuinely caught me off guard when I first looked at the data. There's a tea, not green tea, not black tea, that has been studied head-to-head against prescription blood pressure medications, and the difference between them was not statistically significant. Hibiscus tea, also called sour tea or roselle or agua de Jamaica in Latin America. The active compounds are anthocyanins, the same pigments that make the tea deep red. These anthocyanins inhibit angiotensin-converting enzyme, AC, which is the same target that medications like lisinopril and enalapril hit. Less ACE activity means less angiotensin II. Less angiotensin II means less vasoconstriction. Vessels relax, pressure falls. Basically, hibiscus tea is doing pharmacologically what an ACE inhibitor does, just at a lower intensity and without the side effects like dry cough or elevated potassium. An umbrella meta-analysis published in 2025, pulling data from 26 randomized controlled trials and over 1,700 participants, found that hibiscus dose-dependently reduced both systolic and diastolic blood pressure. When compared to placebo and other teas, systolic blood pressure dropped by about 7 millimeters of mercury. In studies comparing hibiscus directly with antihypertensive drugs, the difference was not statistically significant, meaning the tea performed comparably. The effect was strongest in people over 50 and in studies lasting more than 4 weeks. An earlier meta-analysis from 2022, published in Nutrition Reviews, showed even stronger results in the placebo-controlled subgroup, a 10-point drop in systolic blood pressure. When I first started out, if someone told me a tea could match a medication, I would have dismissed it. But the data here is hard to argue with. 2 to 3 cups a day is the dose used in most trials. You steep the dried hibiscus calyces in hot water for about 10 minutes. You can drink it hot or cold. Just avoid the pre-made bottled versions that are loaded with sugar. Those will undermine the benefit. And it's not just your blood pressure. In the same studies, hibiscus also lowered LDL cholesterol and fasting blood glucose, addressing 3 cardiovascular risk factors simultaneously. Now, here's where it gets interesting. Strategy 5 is not something you eat or drink. It's something you may be doing every single morning that is quietly sabotaging everything I just described. Let me take you back to how the nitric oxide pathway works. You eat your spinach. The nitrate reaches your saliva. The bacteria on your tongue convert it to nitrite. The nitrite becomes nitric oxide. Your blood pressure drops. But what happens if those bacteria are gone? The answer is nothing. The whole pathway shuts down. And that's exactly what happens when you use an antibacterial mouthwash. Chlorhexidine, cetylpyridinium chloride, the active ingredients in most over-the-counter and prescription mouthwashes. They don't just kill the bacteria that cause bad breath, they kill everything, including the nitrate-reducing bacteria that are essential for nitric oxide production. A study published in the American Journal of Hypertension recruited 15 treated hypertensive men and women, average age 65, and ran a randomized crossover trial. For 3 days, they used an antibacterial mouthwash. For 3 days, they used water as a control. When they used the mouthwash, oral conversion of nitrate to nitrite was virtually abolished. Salivary nitrite plummeted, plasma nitrite dropped, and systolic blood pressure went up. 3 days, that's all it took. A 2024 review in Frontiers in Cardiovascular Medicine went further, proposing that certain oral nitrate-reducing bacteria could actually be used as probiotics, deliberately introduced into the mouth to enhance blood pressure control. We're not there yet clinically, but the direction of the research tells you how important these bacteria are. An estimated 60% of adults in the United States use an antibacterial mouthwash daily. Many of them are seniors, using it on the recommendation of their dentist. And nobody, not the dentist, not the cardiologist, not the primary care doctor, is connecting those dots. Now, remember Margaret? She was eating her spinach, she was doing her walks, she was measuring her food, but every single morning she was rinsing away the very bacteria that would have turned that spinach into a blood pressure medication. And every evening she was taking omeprazole, depleting the magnesium her arteries needed to relax. When her doctor finally suggested she switch to a non-antibacterial mouth rinse and talked to her gastroenterologist about whether she still needed the omeprazole, her systolic dropped 11 points in 6 weeks. No new medications, no new supplements, just removing 2 things that were working against her. And what surprised me most, no one connects these dots. The cardiologist prescribes the beet juice, the dentist prescribes the mouthwash, and no one realizes one is canceling out the other. So what should you do? Talk to your dentist. Ask whether you actually need an antibacterial mouthwash or whether thorough brushing and flossing would be enough. If you do need some kind of rinse, ask about non-antibacterial options. Don't stop using it abruptly without a conversation, but do have that conversation. And it's not just your blood pressure. These same oral bacteria play a role in exercise performance, cognitive circulation, and how your body manages glucose after a meal. Let me pull all of this together. Blood pressure in seniors is not just a sodium story. It's a story about deficiencies, potassium, magnesium, nitric oxide, multiplied by habits and medications that nobody thinks to question. A mouthwash here, a reflux pill there, and suddenly the spinach salad you eat every day can't do what it's supposed to do. But the reverse is also true. A few smart changes, a different salt, more leafy greens, attention to magnesium, a cup of hibiscus tea, and a conversation with your dentist can shift the equation in your favor. Not by a little, by the kind of numbers that clinical trials spend millions of dollars trying to achieve with new drugs. Here's what I want you to do today. One thing. Go to your kitchen. Look at your salt. If it's regular table salt, replace it with a potassium-enriched salt substitute. One swap, one purchase. backed by a trial of almost 21,000 people published in the New England Journal of Medicine. That's the kind of evidence most medications would dream of having. Every week you wait isn't just a week of high numbers on a screen. It's a week of sustained pressure on arteries that are already stiffer than they were 10 years ago. But every week you act is a week those arteries get a break they haven't had in years. You don't need a perfect diet. You don't need to overhaul everything. You need a few targeted changes, the ones that actually move the needle. And now you know which ones they are. I'm curious, how many of you have been told to just cut the salt and nothing else? And how many of you are using an antibacterial mouthwash every day without ever being warned about this? Drop a comment. I read every single one.